Hello, this is Christine Sullivan, National Clinical Manager for BSN Medical. Today I'm going to talk about Cutimed Sorbact. Cutimed Sorbact is redefining infection management by providing an alternative way of removing bacteria from the wound. It physically binds with bacteria. It's a replacement for silver dressings and other chemical antimicrobials. It quickly binds and inactivates bacteria, including MRSA and VRE. It improves healing time. In one study, there was a 40% reduction in healing time versus silver. Because it's not a chemical, it's naturally safe and effective. There is no known cytotoxicity, no systemic absorption, and it can be safely used on all populations, including newborns. It's cost-effective versus other antimicrobials, and there is no bacterial resistance. Silver and Sorbact have different modes of action. Both reduce bioburden, but in different ways. Sorbact uses a physical mode of action. Silver uses a chemical mode of action. Silver works by disrupting the cell wall of bacteria. It breaks down the cell wall, disrupting the respirations of the microbe and attaching to the DNA to stop cell replication. As a result of breaking down the cell wall, endotoxins and bacterial debris are left in the wound, prolonging the inflammatory process. Unlike silver, Sorbact uses a physical mode of action to physically bind with the cell wall of bacteria and does not break down the cell wall. As a result, there is no endotoxin release and bacterial debris is not left in the wound, which would prolong the inflammatory process. Because it's not a chemical agent, it avoids the risk of cytotoxic reactions, systemic absorption, and bacterial resistance. Some facts about bacteria. Wound pathogens, bacteria and fungi, express cell surface hydrophobicity. A substance is hydrophobic if it repels or does not mix with water. Hydrophobic interactions occur when microbes repel water molecules and bind together. Bacteria use hydrophobic interaction to bind together. They need it for microbial life. They need it for cell-to-cell communication, to exchange DNA, to bind to molecules for nutrition, to bind to surfaces for rest, to adhere to host tissue in the initial phase of wound infection, and for protection against phagocytosis. Hydrophobic interaction also plays an important role in biofilm production. Like bacteria, Cutimed Sorbact is also hydrophobic and uses hydrophobic interaction to bind with the bacterial cell wall. Cutimed Sorbact is coated with DAC technology, diacocarbomoyl chloride, which is a hydrophobic, water-repellent fatty acid derivative. Bacteria with high cell surface hydrophobicity are tricked and bind irreversibly to the green-coated dressing surface. Cutimed Sorbact effectively binds common wound bacteria, including Staphylococcus, Pseudomonas, Enterococcus, Klebsiella, and Candida. Studies have shown that bacteria bind 10 to the 5th within 30 seconds of application and reach 10 to the 8th within 2 hours. Also, once bacteria are bound, they exhibit a decreased rate of replication, slower metabolism, and a decreased production of bacterial toxins. Next, we'll watch a short on Cutimed Sorbact.
DAC technology, redefining infection management. Silver-based dressings are known to treat infected wounds. They kill bacteria by disrupting the cell wall, releasing bacterial toxins into the wound, and ultimately delaying wound healing. Now there's an alternative. DAC, or diacocarbomoyl chloride technology, is an innovative alternative for topically managing infection. DAC technology is a highly hydrophobic fatty acid derivative. In an aqueous environment, two hydrophobic molecules are attracted to each other, forcing the surrounding water molecules to part and allow hydrophobic molecules to bind together. Bacteria have a naturally hydrophobic cell surface. When they are in direct contact with a DAC-coated dressing, they bind and are rendered inactive, unable to replicate. Through this hydrophobic interaction, wound bacteria are drawn and irreversibly bound to the dressing. Bacteria are safely removed from the wound and natural healing can occur. The more highly virulent the bacteria, like MRSA and VRE, the greater the attraction to DAC technology. Cutimed Sorbact with DAC technology, redefining infection management. Quickly binds bacteria, improves healing time, is naturally safe and effective, and has no known bacterial or fungal resistance. Discover the DAC difference.
Cutimed Sorbact is indicated for clean, contaminated, colonized, and infected wounds regardless of the etiology and include venous ulcers, arterial ulcers, diabetic foot ulcers, pressure ulcers, post-operative dehisced wounds, traumatic wounds, and wounds after excision of fistulas and abscesses. Cutimed Sorbact comes in a full product assortment, depending on your clinical goals in the degree of exudate. Cutimed Sorbact comes in superabsorbers, silicone foam dressings, products to support autolytic debridement, packing strips and rounds, post-operative dressings to help prevent surgical site infection, and wound contact layers. For effective bacterial binding, Cutimed Sorbact must have direct contact with the wound bed for hydrophobic interaction to occur. It also must be in a moist aqueous environment and should not be used in combinations with ointments or creams such as Santyl that would inhibit hydrophobic interaction. The dressing change frequency will depend on which product you're using, and it will also depend on the exudate level and the degree of wound contamination. Most of the products can be left in place for up to 7 days. Cutimed Sorbact Hydroactive B can be left in place for up to 4 days. For more information on the specific product, please refer to the package inserts. Cutimed Sorbact has proven clinical outcomes. To date, there are 2 randomized control trials, 10 plus peer-reviewed articles, and 45 plus case studies and posters, with proof of bacterial binding, even with superbugs such as MRSA. There are studies versus silver, including Aquacel AG. There are randomized control trials with reduction of incidence of surgical site infection and prevention of infection, and studies regarding the safe and effective wound healing, reduction of exudate, odor, and pain. For more information, please visit www.bsnmedical.com or call 800-552-1157.